We are dealing with a controversial topic today on Odyssey House Journals, and I want to start out by saying that Odyssey House in no way endorses or opposes what we're talking about today. And I think it's important to take notice of that, because this is a podcast dealing with addiction and recovery, and we want to consider all aspects of addiction and recovery, and this is one aspect. So saying all that, I don't want to be sued or have somebody say, "Oh, you said that this is a solution." Okay, we're talking about Kratom, Kratom.
Yes, and some people say it Kratom. So you get Kratom, you know. Okay. There's lots of different ways that people say that. But
welcome to another edition of Odyssey House Journals. I'm your host, Randall Carlisle. My co-host, Nicole Slack, and Lora Romney is our guest today, who, why don't you tell me what you think about Kratom, not as it deals with addiction, but what value does Kratom have? Because there are people with negative views of Kratom and people with positive views.
Sure, absolutely. So, I found myself years ago coming across Kratom, because what my situation was is I have a really rare condition called trigeminal neuralgia, which is a chronic facial nerve disease that actually is deemed one of the most painful conditions that a person can get.
Do you have pain in your face?
I actually do. The top half, I'm kind of rare. A lot of people have it in their jaws, but the whole top half of my face feels like, you can imagine, an ice cream headache that never goes away.
Whoa.
That's that deep, that when you get that ice cream headache, that's the trigeminal nerve that's being activated. And so that burny feeling that you get is what I get on my face 24/7. I've had this for almost 14 years. I've dealt with this. And so it's just absolutely debilitating.
Is it genetic, or what does it come from?
No, some people have it come from a trauma, from an accident, from dental work. Sometimes they'll have that happen. In my situation, I honestly do not know what triggered mine. I simply woke up with it one day, and it's just never gone away. And I, started like anybody else with a chronic condition, or a condition that pops up. Of course, I went through every modality trying to come up with what was wrong. It took me a year to get diagnosed, went to 5 different neurologists, finally was able to get diagnosed. And I was very convinced that I was going to be able to find a cure for this, or come out of this. And I then proceeded to do everything under the sun. I mean, I probably ended up, in the end of the day, taking over 30 different pharmaceuticals, not at the same time, but cycling through them. Did things like Botox. I had numerous blocks where they put hoses up my nose to shoot a lidocaine into my brain. Into that neuro region. I went through everything, and I was so ill that I was up at the University of Utah Hospital about once every 10 days getting IVs for the pain, because I was a 10 and could not stop. I was actually even admitted for a week into ICU up at the University of Utah Hospital. So I was really bad. And finally, they did a very invasive procedure called the microvascular decompression surgery, where they actually went into my brain and they decompressed the nerve in my brain to try to put a little cushion in there to try to relieve that pressure from the nerve onto the artery. And so I survived that, and that helped a little bit. I've never gotten quite as bad as before that surgery, but it still just did not resolve the pain. And then I resorted to getting a stimulator implanted in my face. So I had a battery pack in my chest with implants in my face to try to stimulate the nerve to try to help the pain. So you can imagine, I literally went through everything. Wow. And years back, before medical cannabis was here in Utah, I thought for sure medical cannabis would be the thing for me, because it had helped a lot of people. And so I actually fought and volunteered as an advocate back then to bring medical cannabis here to Utah for patients. And when I was able to finally appropriately try cannabis, it just didn't work for me. It did not help my pain. It actually made my anxiety go up. And I did not like the altered feeling that it gave me. And I got no relief. So I was just distraught. I was like, I'm out of options. There's nothing left for me. I was in pain management. They were giving me 2 oxycodone per day. But if you're familiar with oxycodone, it only lasts for about 4 to 6 hours. Well, you have a 24-hour period of time. So I had to decide whether or not I was going to sleep at night or I was going to function in the day. And they would not give me any more medication.
Because of the fear of addiction.
Because of the fear of addiction. Okay. So I was desperate. And I thought, they call it the suicide disease for a reason, because people get to that point where you're just miserable. So I had heard about this plant Kratom from a friend of mine that actually lives in Iowa. And he had said to me, you got to try this. It actually works. And I thought, well, I've tried everything else. So I ordered the powdered plant, and I thought, well, I'll give it a go. And I tried it, and I couldn't believe it. Within 20 minutes, my pain had dropped. And honestly, I couldn't believe it, because I didn't want to even tell my husband that I was taking it, because I had, he had gone through this whole journey with me. Sure. And I didn't want to get his hopes up. So after about a week of me really being able to take this, and by the way, I instantly dropped to 1 opiate per day the minute I started that. And so I was able to take a morning dose of an opioid, and then the rest of the day and through the night, well, I didn't even need it at night, I was able to sleep. I could take Kratom, and it helped. So
how long ago was this?
This was 8 years ago. And
you still do it?
I still
it still is effective?
Absolutely, yes. And I still take the same dose as I did back then. So it's been a real miracle for me. I was able to, again, drop off of all of my opioids, which has been a real blessing. And so I'm able to control my pain without that. All full disclosure, I do have a pain prescription for the severe flares, but I usually only have to take like 1 pill about once a month. So that tells you that amazing transition I was able to make out of a substance that...
And you brought some Kratom with you.
I did.
Where do you, first of all, describe what Kratom is? It's from a plant, right?
It is. It's from a tree that's in Indonesia and Thailand. It's grown there. It's a very wet climate where a lot of humidity, and so it doesn't typically grow here. There's some places in Florida and Hawaii where there are some places, but most of the time it is imported. So they actually take the leaves off of the tree, and they dry the plant and put it into just a powder. That's all it is. And then they import it here to the United States. It's put into, all it is a dried plant leaf. And then some manufacturers put it into an extract. So they actually but it is still plant material. It's just using like an alcohol-based, extracted. So it's more of a potent thing. And you find that in more of like the little shots and things that are definitely stronger. So, you obviously, when there's anything that's an extract, it's going to be stronger than the plain plant. So you want to always look and follow those instructions on the label. But
how do you ingest it?
So I take mine and I put it into water. I have a little blender bottle. I dump about a half a teaspoon into my blender bottle. The dose depends on, people's weights, lots of different things. But my dose is about 1.5 grams I take to 2 grams. And I put that in water, shake it up, and drink it. And
what's it taste like?
Imagine what a dried leaf would taste like. It doesn't taste good. It's kind of got a bitter taste. Some people mix it in with orange juice, and I doctor it up with some water flavoring. So, and then, take a mint or something after, because it's not really appealing for sure. Not something like kids would ever want to drink.
How much does it cost?
So, interestingly, a good question. If you were to buy it in typical places here in Utah over the counter, so if you were able to go into like a convenience store or a smoke shop, which is where they're sold, and they're sold behind the counter as adult use only, because that is the rule here. That is the law here in Utah. It only is an adult 21 and up. So you have to be carded to be able to purchase this. Once I purchase that, it is a lot more expensive at those facilities. So most of the time, if you are, a constant consumer, you will order online, and it's a lot cheaper. So for me, it costs me on an average of about probably $40 to $50 a month for my, to be able to consume Kratom. So it's another very reasonable option. And for me, it's great because I've been able to come off all of my other medications. I'm not taking any others. So It's been a real blessing for me.
Now so in Utah, it's legal to buy.
Correct.
if you're 21.
That is correct. Yes. Yes. We have what they call the Kratom Consumer Protection Act that has been passed. It was 2016, 2017, it was passed. And Utah was actually the very first state in the nation to pass that law. And we had our, sponsored by Utah senators, and it was voted in, and it's been in place ever since. Utah is really an amazing state. We are kind of the flagship state for the whole nation because we've really done it right. We have got it. Our Department of Agriculture is who oversees that. And we actually have, if you can even go online and see, there's a product registration so that everything that is allowed to be sold here in the state is on that registration list. So the inspectors can go in and make sure that, stores are in compliance. They're, selling it behind the counter. They're labeled correctly. So that's the other portion of the KCPA, that it says you need to have product that's properly labeled, and it shows dosages, it shows what's in it, the content of the different alkaloids that are inside there, so people know what they're purchasing. Like, for instance, on this package, you can see on the back, it has a batch number, it has suggested uses, it has the suggested dosing. It also has the appropriate FDA notifications for any dietary supplement that are on there. So if you would feel safe ingesting this product, saying, hey, this has been safe, this has been tested, I know there's no heavy metals or salmonella, and you're able to, feel comfortable. So that's what we want here in the state, because we don't want anybody coming in, purchasing something in a baggie that would not know what they're purchasing. So
now some states have banned it.
That's correct.
Why?
Good question. So interestingly enough, you have to go back to history to about 2016. So the FDA at that point had Kratom became on their radar. They were like, this is a drug of concern, and they didn't really know what it was. And
gas station heroin.
Yes. Well, and that's another thing we'll cover. But they were concerned about Kratom. So what they did as any product of concern, they say, we're going to shoot this to the DEA because we think this product needs to be scheduled. So what the DEA does at that point is they do what they call an 8-factor analysis. So basically what that is they go in and they study all these different factors that say whether or not the substance should be scheduled. The DEA took their time, did the 8-factor analysis, came back and said, based on our findings, this does not meet scheduling qualifications. And for the first time in the history of the DEA, they kicked back the request for scheduling and said, this does not qualify. So what had happened is when the FDA had said this, there were several states that were sure this was going to get banned. So they just jumped on the bandwagon and just started banning. And so now those bans have kind of stuck in some of those states. But Rhode Island this past year just overturned their ban that was set back in 2016, and it will now be legal in Rhode Island starting on April 1st of 2026.
Okay, I understand your usage of it.
Yes.
But we obviously work at Odyssey House, and we deal with people who are addicted to whatever substance.
Correct.
And there are claims, right? I've read many of them, that Kratom can be used to help with the withdrawal symptoms from opioids.
Correct. Yes.
Has that ever been proven, or is that because I threw out slang-wise that people refer to it as gas station heroin.
Yes. And how that term got coined was way back then. There was actually a substance that's still out there now. A lot of places have banned it, called tianeptine. It's another real hazardous substance, and that was claimed it was gas station heroin. That was the original subject that got that name, but then some media person just jumped on that, and it,
Damn media people.
It's a great headline, it makes it sound all scary,
right.
but the reality of it is, and we'll talk a little bit about this, the real risk is the synthetic products that are coming out right now. And they are what are flooding the market. The 7-hydroxymitragynine, or 7-OH for short, those products really are, quote, in my opinion, they're closer to gas station heroin. Let me tell you why. They are 14 times stronger or even higher than morphine. And if you do not have the Kratom Consumer Protection Act passed in your state, which we do in Utah, you can go on over the counter, and most of them would ask for ID and such, but you can go and purchase these 7-OH products at a gas station or smoke shop.
Okay, and let me just ask a few questions.
Sure.
Okay, 7-OH, if you consume that, can you get high?
Yeah, so let me explain what 7-OH is first so you understand. So remember I talked about the actual kratom leaf. So the kratom plant, when you actually pull the leaf off the tree, there is no trace of 7-OH at all in the plant. But when it starts to dry, it starts to create this alkaloid. And so you get a trace amount of 7-OH in the actual plant. So in this package, it would be it would be less than 1% in most situations. So very, very small amounts. But what these 7-OH manufacturers have done is they have taken that trace element and they have basically treated it with, they've even said it on camera, with like chemicals that are used to do pool shock. And they will create a tablet. Most of the time it's in a tablet. They have lots of other types of varieties too, but they put them in a tablet and they're extremely potent. And so basically one little tiny tablet is like consuming massive amounts of the powder. So it's extremely powerful. And yes, absolutely can make you high because it is so powerful. And that, it really does have some addictive qualities because it has such a short half-life. So the hard part is that people are mixing up the two. Because a lot of the 7-OH manufacturers are going in and they're putting on their packaging that they say that it's an advanced kratom alkaloid. So people tend to think,
which is not a lie.
That's right. It's a trace amount. It's a synthetic product, but they have pulled it from a trace element in the plant. So it is they call it semi-synthetic, but the reality of it is it's a synthetic product.
So it gets you high, and can you get addicted to it?
Yes, you can. It does have pain. It does have a lot, obviously.
So you have withdrawal if you stop.
Yes, correct.
Would you have withdrawal if you stopped?
Now, if I did, because I've been an 8-year user, I would want to taper because typically for me, again, I don't take a high amount, but I might feel with a headache, I might feel a little fluish for a few days, but it's nothing like what an opiate withdrawal what you would go to. Now, that being said, if you were on, you were taking like the shots, like high amounts of the shots, you would definitely feel more because it's more, it's definitely a stronger product. And so again, you could withdraw from that by just tapering back, but you're not going to get that instant withdrawal where the 7-OH, the withdrawals are sudden. In fact, I have heard reports, this is just me, heard reports that once you start continually taking it, you can actually start to get withdrawals within 4 to 5 hours if you're a daily user. So it's very potent, and we definitely don't want that on the shelves. And so that's where Utah has done a good thing. That being said, I know there's a senator that is speaking about even making firmer rules for 7-OH so that, it becomes like a Schedule 1 or something.
Is there anything wrong with banning 7-OH in Utah?
Well, so that's a good question. So I don't believe so. So remember how we went back to the DEA, how they threw out the scheduling for that. So now, just this past year, the FDA has seen what's been going on. They've seen what's happening with 7-OH. By the way, 7-OH hit the market about 2.5 years ago, and it's just blowing up. Especially, again, Utah, you don't see it so much here, but in states where they are selling it, it's like 80% of what they're selling.
So you can't sell it here.
That is correct.
But you can buy it on the internet.
That you shouldn't be able to, but it's just like black market type thing. It happens.
So you've been on the same dose for how long?
8 years.
And you haven't built up a tolerance? And
No. But I also have gone into the mindset that, I'm not out to cure it. I'm not out to realize I'm not going to take my pain away. I know that. In fact, at my very best, I'm probably a level 3 in pain, but it pulls me down from anywhere between a 5 or a 3 to about a 5 or a 6, which is completely livable. But let me go back real quick and then I'll answer that. But I want to go back to what the FDA did and what they said. So this year, they said, we see what's happening with 7-OH. It's a real public health crisis. So they actually did on July 29th, you can look it up, they did the FDA and the Health and Human Services did a press conference where Commissioner McCary said, we are asking the DEA to schedule 7-OH as a Schedule I controlled substance. So they did the same thing that happened back with Kratom. They did the 8-factor analysis. That 8-factor analysis was turned in to the DEA on September 29th, and it does show that the recommendation is for 7-OH to be a scheduled product. And so we are just now we had the government shut down, which stalled things, but we're kind of expecting any time for the announcement to come out that the DEA will schedule 7-OH. And then once they do that, if it's an emergency scheduling, it will be off the shelves in the entire United States, no matter what.
Would it affect the sale of
No.
like what you're buying?
Absolutely not, because this is not a 7-OH product. This is just a pure Kratom product. One thing that the Kratom Consumer Protection Act does as well is it puts in a cap for 7-OH. Because, there could be products where, there's always manufacturers that say, well, I'm going to push the limits. I'm going to see how high I can go. Even though I'm not going to do a full 7-OH, product, I'm going to see how high I can go. No, if you have that cap in place, there's a ceiling and you can't go above that or you're against the law.
Would you say that Kratom has any relevance to somebody who is dealing with substance abuse?
Yeah. So let me tell you about a story about my friend Misty. She lives in Colorado, and she was a pain patient and had started getting on. They overprescribed her opioids back then, and she became addicted to them. And so after that, she started getting into harder substances, missed a pill count, and was cut off of pain management, and went to the streets and started buying harder substances. And so she was in full active addiction and really bad. So she decided, because again, she got pulled out of that pain prescription, she thought, I've heard about this Kratom. She walked down to the smoke shop, bought some Kratom, and took it, and not thinking much of it. And she said, I couldn't even believe it. Like 5 or 6 hours later, I was like, wait a minute, I didn't crave that hit. I didn't crave the drug. And she said, I thought,
dope sick.
She said it was like somebody switched the light off and she just didn't have that craving. And so she's like, I honestly couldn't believe it. And she said, it was like my mind was finally settled, because before, again, I have not been in active addiction with either alcohol or substances. But she said, your mind is constantly going, when am I going to get that next hit? That next rush, that next drink, whatever it is. She said it just shut that switch off, and I was able to do that. Now, she did start with a higher amount of Kratom as she came off, but then was able to just taper down. So she takes it just a couple of times a week. She takes a break, and she just has a little maintenance dose to keep her clean. And she's, it's accountability too, as you know, with addiction. It's you've got to be ready. You've got to be in that mental place where you are saying, I am done. I want to change my life. And that's so hard when you're dealing with withdrawals. And, but if you can find a substance that's, been shown that does not have respiratory depression, that is, going to help with those withdrawals, it's definitely a good option for people.
You have any thoughts on that? You work with people in admissions all the time.
Yeah, I guess now I don't know what type of Kratom they were taking.
That's the big question that you really
had
need to
people
ask.
Do we have people coming in who are?
Not for just Kratom, but Kratom's been on the list. So, but now I have
So
a
when
better
we ask what
understanding
drug of choice, they list Kratom.
Mm-hmm.
And then what's interesting is some of these people could be, technically, they could be saying, I want to come off heroin, and they've tried Kratom as, maybe a tool to be able to help them come off. And so, yes, you could be seeing situations where it tested positive or they claimed.
Yeah, I don't think we tested, but I definitely have had people say that was one of their drugs of choice.
Okay.
But now with a better understanding, knowing I don't
Definitely
know which one.
ask the question
Right.
with the 7-OH. And interestingly, some people may not know, or they may not tell you, because they're conflating the two. One thing that's interesting about the 7-OH products is if you actually see them, they specifically name them after things that mimic narcotics. They have names like Opia and Perks and 7-ohms and all these things that have that allude to the fact that you're taking a narcotic. The other risky thing about them is they're actually creating products that are appealable to children. There's literally been ice cream cones. There's been gummies. They have packaging looks like a gummy, that like Hulk type gummy that a child would want. So that's scary too. I've even seen it in like cough syrup format.
Wow.
It's definitely something that is there. And again, the difficult thing is if someone wants to abuse something, they're going to definitely want to go to the 7-OH because that is the hit.
And I read that in our regular UAs, our drug screening panel, it doesn't test for Kratom.
It does not that I'm aware.
Some don't. Yes.
So you have to specifically ask for
It
them.
is. It's a different panel.
You'd have to pay more for that kind of test.
It's definitely a different panel that you would do.
Kratom would not be allowed in your houses.
No, not at all.
Which would make sense
Yeah.
because you are, of course, you're in a controlled environment where you're helping them, come off of these substances.
We also don't allow nicotine. So
There you
just
go.
teaching people to come off substances. But yeah, I think my concern would be replacing an addiction. So
Correct.
You're right.
Right.
Yeah,
100%.
What concerns me is, and that's why we started out saying what I said, is we're not saying that, okay, if you're watching or you have a loved one who is a heroin addict or fentanyl or whatever, we're not saying that this is a solution.
Right, right.
But I suppose.
But it has been for some. I know a gal who, again, she's 8 years clean off of she went to rehab 3 times with a heroin problem, and she has been now clean for, I believe it's over 8 years. And so it's, it can be a solution for some, but again, it's definitely something you'd want to work with your doctor on. You'd want to, you'd have to be careful. And that's what I think the biggest thing I'd have to say today is personal accountability is everything. And, I know people out there that drink 4 energy drinks a day. And I'm just like, oh, I mean, no one should
Not
be
me.
drinking 4 energy drinks a day.
Yeah.
And so, it's personal accountability, and it's saying, I'm not going to go out there and chase, but until that person is ready to go into recovery and they want to get that mindset, they're going to struggle, and no matter what it is, and they're going to go to the next substance and the next. And it's, addiction is it's a difficult
Disease.
solution.
Yes.
It is absolutely. It's just a hard thing. But, this is a situation going back to the pain patient thing again. Right now, because of the whole opiate epidemic or the overprescribing that happened, all of the pain patients are being literally pulled off of their opiate prescriptions.
My girlfriend has chronic back pain,
Yep.
and she runs out of pills. But
Exactly. And so it's like, but yet you go to the pain management and they say, well, a lot of these doctors are risking their own licenses
Sure.
prescribing. There are pharmacies that won't fill it. Now you add on the fact, we all know addicts still get pain. And if anybody that's an addict, you go into the hospital or whatever, you're blacklisted. You're getting nothing. You're getting this Tylenol.
Right.
And so that's where it makes it a really difficult thing too, because, whether you're an addict or a not addict, pain is a real thing. And people are literally having all of their options stripped away from them. They're not able to get pain medication anymore. I read story after story every single day where people are literally suicidal because they have been pulled off of, we're talking cold turkey pulled off. And you wonder why we have a problem with the fentanyl epidemic in this country. Well, there's one of it. You get somebody in that level of pain with zero help, especially if they've pulled them off of their opioid cold turkey, they're going to go to the street, and you're going to end up with a fentanyl death.
Lora Romney, thank you very much for being our guest.
glad.
This has been.
I feel very informed now.
I do too.
You please call me with any questions you might have. And I really advise you to go to the www.americankratom.org to learn more, or kratomanswers.org. That's some really great information. I will definitely say that do your research, because you're going to get, for instance, you're going to get the first hit. If you Google it, you're going to see Mayo Clinic. Mayo Clinic says it's bad.
Right.
Well, Mayo Clinic hasn't done one single study. Johns Hopkins University and University of Florida, they're championing this. In fact, even NIDA has voiced their great respect for this plant and the potential it has. So
Her advice is perfect. Do research before you do anything.
Absolutely.
Thank you for watching and listening to another edition of Odyssey House Journals.